go back to you, Dr. Wright. I thought you made some really good points, and so let's make this clear for everybody at home. You need to have somebody in whatever you're looking at, whatever you think your disease might be or condition. If you're just online and you're using AI online, you need a healthcare professional to help you interpret that to make sure that you haven't gotten a hold of some rogue, untested AI. Is that basically part of what you said? I know it's not the whole 5 minutes, but you took about a minute on that. Is that correct?
Yes, that's correct.
And so we need to make sure that we have the clinicians involved because, originally I was going to ask Dr. Ibrahim this, but I have a article I read a couple of years ago coming out of the London Times related to AI diagnosis of lung disease from x-rays, and the radiologists actually did better than the AI because there were so many different factors that had to be looked at. And in a different study, part of the problem that was identified was they had gotten a lot of the input data from sub-Saharan Africa where the conditions were very different than the conditions in Europe, and they were given a lot of false positives. And so what we have to do is we have to figure out how much data has to go in before it's effective. And if you could tell us if you haven't, and I know there's no magic bullet, but roughly, I mean, how much data has to go in? And I guess the more complicated it is, the more data you need, but you need a fair amount of data in order to make the AI work correctly. Isn't that a fair statement?
Thank you, Chairman Griffith. I agree with your point and maybe would add to it that it's not just the amount of data, but it's the correct data. And ideally, to get these models to function correctly, you want to train them on a population that's similar to the one you're treating. In our experience with stroke, a lot of our initial data came from the Southeast United States because that's where the stroke belt was. And so training our models there was relevant. And that's been a learning curve of the field to know to do that. So I appreciate you raising that point. It's incredibly important.
Yeah, I appreciate that. I am excited about the potential of AI. Mr. Toy, you raised the issue, and Marvans, if I said it correctly, and I hope I did. But I have two cases at home that I know about. One was a friend of mine who had a form of ALS, but apparently there are 4 or 5 different types, and to get the proper treatment, it took them several years to figure out exactly what version of the disease he had. And wouldn't AI, I mean, I grant you got to get a lot of data in, but wouldn't AI help shorten the time period to eliminate or to identify which type that he might have had? He's since passed away. The treatments just weren't there, and by the time they diagnosed it, it was not possible to get him what he needed. But wouldn't AI help with making that identification shorter? Mike?
Absolutely, thank you. Definitely, obviously we look after a lot of ALS people in our population, and within Marfan, I have type 4, and there's like many different types, exactly as you just said, which under standard protocols of care are treated actually very similarly. I think with AI, you can match symptoms, you can match genotypes, you can match phenotypes much more precisely in that N of 1 personalization I was talking about, so that you can then match care protocols, drug protocols directly to the kind of disease that your friend unfortunately.
Yeah, and this can also help in the population that doesn't have a family history. I know of a case where an individual who was adopted had no clue that they might suffer from Huntington's. It turns out that's what they had, but they spent a year or more looking at MS and other muscle diseases before they said, wait a minute, maybe it's something we haven't looked at. And AI might help identify based on the symptoms. It might help quicker identify. And that's not to say that doctors were doing anything wrong. It's just that they've got hundreds of options, and AI can help cut through those options, can it not?
I think absolutely. When we talk about earlier identification, this is a huge area that we're seeing already happening with AI, where a doctor will be doing the right thing and looking at this set of symptoms, but then not thinking as much about something that's a little bit rarer or not obvious. And AI can notice something there in the symptom set and bring it to the doctor's attention, and the doctor then says, oh yes, I should consider that. And that's a big area we see that doctors are saying is helpful to have from AI.
Yeah. All right. Last but not least, my district is very rural and economically stressed. Most of my hospitals and community health centers run on very thin margins. What type of upstart software is needed for rural health entities to use advanced AI and machine learning, and is it expensive?
That's a great question. I think that what's really exciting is that the infrastructure we're building on AI and the infrastructure the country has built on cloud means that we can deliver these capabilities very quickly to more rural areas, to smaller towns, and they can enjoy the same benefits that a larger, more dense urban center would have, and the same coordinated care as well between different sites of care. So that local independent pharmacist in the small town would be coordinated with the local family doctor in a way that they've never been able to before.
I appreciate it very much.